It all started back in 2008. I traveled to Tanzania. I had newly got a degree in pharmacy, and I went to a small hospital, a small district hospital outside Arusha in the northern area of Tanzania. And I was to work there as a clinical pharmacist to sort of manage the hospital pharmacy. And one day, after I had been there for probably 3 months, I heard a child crying, a girl crying. I went out from the hospital pharmacy to see what had happened. And then I went into the minor theater where they usually changed bandages. And what I saw there, it completely broke my heart. I saw this little girl. She was about 6 years old, and she had 3rd-degree burns over almost 40% of her body. They were covered in open wounds, and it was just awful, heartbreaking. This little girl, this little body with such a big wound. And the whole situation seemed hopeless. You could tell that the staff had their challenges. The girl, whom I later known to be called Faraja, she was in despair. Her father was in despair. It was a difficult situation. There she is. She's there. Oh, no. So after meeting Faraja, I knew in my heart that I wanted to help her, and I needed to do something. But the problem is I didn't know exactly what to do, because I had never seen anything like this before. I had never seen such an extensive burn injury, and I didn't even know actually what it was or what caused it. And I didn't know what huge problem it is. The family, they live very traditionally. They make food over an open fire. And this is the root of the problem for many more children like Faraja. The cooking takes place over open fire. Hot water, hot oil, or open flames itself is the cause of burn injuries like this. But what I did was that I telephoned my father and I cried for help. And my father, he decided to contact the burn unit in Bergen in Norway and ask if they could maybe give some advice. And the day that he called, miraculously, there was a man there, a doctor, Dr. Einar Eriksen. He had, one year ago, he had left his position as a ward manager, and he had moved to Ethiopia to take care of children with burn injuries and try to teach local Ethiopian doctors burn wound care. And that day, he and my father, they got to talking, and later on, I got to talk to Dr. Einar Eriksen myself. And a relationship was established between him and I. So, in November 2008, Einar, he traveled to Moshi, to Arusha, Tanzania, and we were there for a week together, and he operated on Faraja. And while he was there, 2 other girls from the local community, they came. They had heard that there was a plastic surgeon in the area, and maybe they wondered he could do something to help them with their old injuries. And they both had contractions on their hands from old burn injuries several years ago, where their fingers are contracted sort of towards the back, making their hands completely unusable. Since 2008, Dr. Eriksson and I have been traveling together to Tanzania. We have been teaching and training local surgeons and nurses within burn wound care and reconstructive surgery.
My main concern is to teach young doctors who are interested, nurses who would love to join a team and to build a team of motivated professionals, African professionals. At the moment I'm sitting here in Moshi after 5 busy days at KCMC Hospital, and I've met a lot of very, very motivated young doctors who would be so happy to get involved in how to manage the treatment and management of burns.
I really like children, so whenever I see children suffering, for me, I try my level best to make sure that child is out of that suffering, out of that disease. So for my side, to see a patient coming with a burn injury and then treat him or her, and then she being discharged at home with a good condition, that is my job. On those children, majority of them, they are coming from low economic status family. So most of the time we get a challenge for treatment for them because they need high protein diet, they need a strong antibiotic. So you find some of the relatives, the parents, they can't afford that. So that's become a challenge to us.
What would hinder the patient and the family to come to KCMC to get treatment?
Most of people, it's because of payment. Yeah, I think that here is very expensive. so they can't afford, because most of people, they come from rural area, they don't have money, so they think that when you are going to SMC, the service is very expensive. So